Well, Matthew's mum, Gloria, is with us. She adopted him when he was 7 months old. And in our Westminster studio, Dr. Mary Mather, as we mentioned, director of this country's first dedicated support centre for children like Matthew. Good morning to you both. Gloria, let me start with you, if I may. You started fostering Matthew when he was very, very young. So you really have not much idea of what went wrong with him, or do you?
I had no idea. I didn't ask to be a foster or adopter. He just entered my life totally uninvited. I had no idea what was wrong with him. I was just told that he was neurologically damaged. He'd been abandoned and left in a hospital in Cape Town, where I'd just remarried and gone to live. And he entered our lives, and it was a chance observation by a social worker at the children's home where my husband and I were house parents. So, do you know that child has fetal alcohol syndrome? I had no idea what she was talking about. I had to go and get a book from the library by Michael Doris, The Broken Chord, which frightened the life out of me, because it's a lifelong disability. It's not going to go away. The only way it's worked for us is by applying early intervention.
And do you have any idea how much his mother would have drunk while he was
No idea. His mum was a university student and so was his father. And grandparents, professional academics, we have no idea.
Dr. Mather, as a paediatrician and the director of this new centre looking at fetal alcohol syndrome, is there much research to say how much damage alcohol does during pregnancy?
Yeah, there's a huge amount of research, mostly from the States, indicating that alcohol profoundly damages the developing brain throughout pregnancy.
How much alcohol are we talking about? Are we talking about a glass of wine a night, or are we talking about binge drinking?
I think the problem is, I don't think we're ever going to know the answer to those questions. Research in this area is very difficult. You simply can't take pregnant women and ask them to drink varying amounts of alcohol. What we can say is that alcohol does damage the baby, and I think more importantly, if you don't drink, then there's absolutely no risk your baby will be damaged. We can say that quite categorically.
I would imagine it's quite difficult to get research as well on how many women drink during pregnancy, because perhaps it's not something that women will admit to.
It's partly that, but I think also the NHS has been quite slow to realise the importance of alcohol. I think we're very tuned into cigarette smoking in pregnancy, but I even find midwives are reluctant to ask women about how much they drink, or even to advise them not to drink during pregnancy.
Gloria, of course, if women didn't drink in pregnancy at all, there wouldn't be a problem, would there?
No, there would not. It's totally preventable with education and awareness. But once the child has got it, it cannot be cured. The child can't be cured.
See, some women will think, well, if I just have the odd glass of wine, just just a little something occasionally, surely that's not going to be a problem.
The only safe message is nil. You're playing Russian roulette with a developing fetus. If you're not 100% that day, you're taking on other medication maybe, you just don't know. Nobody should take that risk. A child is so precious.
Yeah. Dr. Mather, can you tell us a little bit more about this centre and how it's going to help children?
Well, it's based in the adoption agency, Parents for Children. And what we aim to do is, first of all, provide better diagnosis. The diagnosis of this condition is quite difficult to get at the moment, and the features are quite subtle. But more importantly, I think, to assess the needs of these children, because they have complex emotional, behavioural and educational needs. And I think probably the most important of all is to provide continuing support for their families.
Are you looking for other adoptive parents? Because as Gloria was saying, it is very difficult looking after a child with fetal alcohol syndrome.
I think there's a huge shortage of adoptive parents, and yes, that's one of the things we'll be trying to do.
OK, Dr. Mather, thanks very much.